The topic which I will be discussing today will be anxiety disorders. Anxiety disorders are a disorder which affects people's lives day in and day out. I choose to speak upon anxiety disorders because I too suffer from this. There are many types of anxiety disorder that include panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, social anxiety disorder, specific phobias, and generalized anxiety disorder. Anxiety is normal human emotion that everyone experiences at times. Many people may feel anxious or nervous when faced with a problem at work, before taking tests, or making important decisions. Anxiety disorders, however, are different. They can cause such distress that it interferes with personal ability to lead a normal life. An anxiety disorder is a serious mental illness. For people with anxiety disorders, worry and fear are constant and overwhelming and can be crippling. This is according to www.webmd.com, Anxiety and Panic Guide of Mental Health. There are many different types of anxiety disorders, anxiety panic disorders. People with this condition have feelings of terror that strike suddenly and rapidly with no warning. Other symptoms of attack include sweating, chest pains, palpitation, which is irregular heartbeats, and feeling of choking, which may make the person feel like he or she is having an attack or going crazy. Obsessive compulsive disorder, which is also known as OCD. People with OCD are plagued by constant thoughts of fear that cause them to perform rituals or routines. The disturbing thoughts are called obsessions, and the rituals are called compulsions. An example is a person with an unreasonable fear of germs who constantly washes their hands. Post-traumatic stress disorder, also known as PTSD, is a condition that can develop following a traumatic and or terrifying event, such as a sexual or physical assault, the unexpected death of a loved one, or a natural disorder. People with PTSD often have lasting and frightening thoughts and memories of the event and tend to be emotional numb. Social anxiety disorder, also called social phobia. Social anxiety disorder involves overwhelming worry and self-consciousness about everyday social situations. The worry often centers on a fear of being judged by others or behaving in a way that may cause embarrassment or lead to a ritual. Specific phobias. A specific phobia is an intense fear of specific objects or situations such as snakes, height, or flying. The level of fear usually inappropriate to the situation and may cause the person to avoid common everyday situations. Generalized anxiety disorder. This disorder involves excessive, unrealistic worry and tension, even if there is little or nothing to provoke the anxiety. And this information you can find on www.healthcare.anxietypanicmentalhealthanxietydisorders.com. As to any disorder, there are symptoms. Before the disorder occurs or during the disorder, feelings of panic, fear, and unease, uncontrollable obsessive thoughts, rapid thoughts of flashback or traumatic experience, nightmares, visual behaviors such as repeated hand washing, problems sleeping, cold, sweaty hands or feet, shortness of breath, palpitations and inability to be still or calm, dry mouth, numbness or tingling in the hands or feet, nauseous, muscle tension, and even dizziness. There are also many cures for mental disorders, such as medication. Drug use to reduce the symptoms of anxiety disorders include antidepressants and anti-reducing drugs. Sometimes these drugs can do the opposite and cause more depression or more nervousness. It all depends on the patient. The doctor normally runs tests to tell which medication the patient may need. There's also psychiatric, a type of counseling, address the emotional response to mental illness. It is a process in which trained mental health professionals help people by talking through strategies for understanding and dealing with their disorder. The exact cause of anxiety disorder is known, but anxiety disorders, like other forms of mental illness, are not the result of a person's weakness, a character flaw, or a poor upbringing. As scientists continue their research on mental illness, it is becoming clear that many of these disorders are caused by a combination of factors, including changes in the brain. And this you can find on www.scientificmentalillness.com. Like certain illnesses such as diabetes, anxiety disorder may cause a chemical imbalance in the body. Studies have shown that severe and long-lasting stress and change the balance of chemicals in the brain that control mood. Other studies have shown that people with certain anxiety disorders have change in certain brain structures that control memory or mood. In addition, studies have shown that anxiety disorder runs in families, which means that they can be inherited from one or both parents, like hair or eye color. Moreover, certain emotional factors such as trauma or scientific events may trigger an anxiety disorder in people who have an inherent susceptibility to developing the disorder. This you can find on www.webmed.com, Anxiety Panic Guide. Anxiety, I think, is one of the worst disorders that is very hard to control. I think at one point in everyone's life, we all suffer from feelings of anxiousness and nervousness. But it is a whole different ballgame when an anxiety attack of your life, and when anxiety takes over your life daily. I personally had postpartum depression, where I was always scared that my son was going to get hurt. From the postpartum depression occurred anxiety issues for a big portion of my life. Anxiety and panic attacks only last a few minutes, but it seems a lifetime to a person that is suffering from it. Naturally, an anxiety attack happens to me when I have too much pressure on my shoulders, or when I sit around thinking about something is going to harm me. Then it just comes on. I honestly don't think that there is any type of cure for this but prayer. I have almost tried 5 to 6 different medications to help me cure this, and there are those mental medications which made me have more anxiety. I now have my anxiety under control for the most part and know how to prevent terrible attacks. A humanistic doctor would probably treat the patient with anxiety by seeing what it causes the problem now in their life. More so with therapy and figuring out their actions now that is causing the issue. A behavior doctor would look at what they do to adapt the patient to new ways of life. A cognitive doctor would focus on changing the beliefs and attitude of the way a person thinks so that they can change the problem. There is also a group doctor will more or so focus on getting you comfortable around people who are just like you. Base the cure on the positive that surroundings you by letting you know you are not alone. Anxiety is an issue that does affect people day in and day out, and being informative about this issue and what you can do to help those people around you or even yourself cure anxiety is very important.